Hi everyone, my PICO question was, in patients with dementia, how does music therapy affect cognitive function? This topic initially drew me in because I've personally experienced a loved one go through dementia, specifically Alzheimer's. I know how devastating the cognitive losses can be for individuals and families. Also, since there's no cure, I was also curious if there were other interventions that could possibly delay or even improve cognitive function. So a little bit of background on dementia is that it's a broad term that covers a group of conditions where the brain function declines over time. The most common type is Alzheimer's disease, which falls under the dementia umbrella term. Dementia is becoming more common with 50 million people affected in 2020, and that number is expected to increase to 152 million by 2050. What's even more important is that 60% of these individuals live in low and middle income countries. This means that a large portion of patients nurses will encounter will have dementia diagnoses. So my paper examined the effectiveness of music therapy in improving recall function and executive skills like orientation and language. My literature search took me a very long time. Initially, I was focusing on just Alzheimer's disease, which gave me very few and unreliable results. But once I expanded to dementia, I had many more articles to work off of. The keywords I used included dementia and music therapy and cognition. I also used the limits feature to narrow my results and the similar articles function to find one of my final articles. The first key finding is that music therapy, specifically in the form of sung melodies, improves memory recall. Also, 2 out of the 5 articles I examined suggested that the implementation of music therapy on dementia patients improved the mental well-being of caregivers. The second key finding is that personalized music therapy improves the orientation and attention levels of dementia patients. Limitations are that most of the studies conducted their research within a short time frame, lacked long-term follow-up on participants, and involved small sample sizes. There was also significant gaps in music therapy literature regarding the standardization of music therapy guidelines. More research needs to be done to identify things like frequency, duration, and content of music therapy regimens for dementia patients. So in conclusion, even though music therapy is a cost-effective and easily accessible, low-risk therapy, its effectiveness in enhancing cognitive function in dementia patients can't be validated through the articles I examined and should not be implemented as an official nursing intervention. Future studies should be restructured in a way that they can deliver replicable and valid results. Thank you.